I'm Marta Schaaf. I'm the director of the program on climate, economic and social justice, and corporate accountability at the International Secretariat of Amnesty International. And I'm also a visiting fellow at UNU Institute of Global Health. Powerful private actors have always played a role in shaping health status and in the ways that we set up our health services, so both in the determinants of health and in our response to health concerns. At the same time, I think too often there's a reluctance to engage in discussion about private actors because we're so used to working within the public sector, which provides most health services, although there are increasingly many private actors involved in providing services. So if we're going to have an evidence-based approach that looks at what's really shaping people's health status and what are the most effective ways of responding, then we need to grapple with these questions. And so having a very honest discussion that is looking at evidence from a variety of different perspectives is a really crucial way of making sure that we're responding to the situation at hand. I was really excited to come here actually, in part because there's a real wide variety of different types of people here. So there are people with different sectoral expertise. So for example, I have a lot of experience in climate as well as in gender. There are folks looking at the role of financialization and how our health services are financed, as well as some of the financial determinants of health. And there are journalists here, there are academics here, there are pracademics here, there are practitioners here. And that is unusual, but really essential in making sure that we're addressing the comprehensive determinants of the situation that we're in. So one of the areas that I spend a lot of time working on right now is climate, right? So we have corporate actors that play a key role in shaping the climate crisis, in deflecting attention away from the drivers of the climate crisis. We know, for example, from litigation that there and open records that fossil fuel companies have known about the harm that fossil fuels do to our climate system since the 1950s, some of them. They also work with a lot of the same consulting firms and public relations firms that other unhealthy commodities have worked with, such as tobacco and big alcohol. And so they're relying on a playbook for deflection and distraction and undermining evidence-based action that we know. And so if we all get together, we can talk about how to address that. At the same time, so we're seeing the climate crisis play out in the proliferation of what we call unnatural disasters, right? Extreme weather events in low and middle income countries. And there are many discussions about how we fund the response to that, both in terms of mitigation, so decreasing carbon emissions, but also in terms of adaptation, right? So making communities better able to weather the climate change that's already baked into the system. So even if we were to stop using fossil fuels tomorrow, climate change would continue to occur. It's already baked in. And so there's a rush for private actors to shape the agenda, both when we're talking about foundations, for example, and for others to see this as an investment opportunity. So some private enterprises look at adaptation as a way of making money by offering some sort of new service. So you can see private actors at every step of the chain, as it were, from both driving the problem to responding to the problem, right? There are lots of academics and civil society actors involved. Those are also private actors, to shaping what we're discussing when we talk about how to solve the problem and to providing some of the services. So not talking about that would be ludicrous from an academic rigor perspective. I mean, there's no one solution to everything, and that's something that we've been discussing already in the panels that we're having. I think as a former academic and as someone who's working with Amnesty International now, I think we see many, many different kinds of policy and action approaches and research approaches to take. Some of those include ensuring that we understand what's going on. So this is kind of a research question, both from an epidemiological perspective all the way to a social science perspective about how decisions are made, how agendas are set, et cetera. We can talk about a bunch of policy responses to ensuring that there's minimal conflicts of interest in research and agenda setting when it comes to both agendas for research as well as for policy discussions, right? So when we're talking about multi-stakeholderism and who's in the room, that we're being critical about the influence that they have over what's on the table for discussion, that we're limiting conflicts of interest among people sitting around a table, and I'm speaking in very simplified terms, right? It is often many tables at different levels of the multilateral system and the national level. We can also think about common principles that we invoke all the time in human rights, right? It's transparency, participation, accountability, access to information, and what we describe as procedural rights. So in the context of Indigenous peoples, for example, this means they have free, prior, and informed consent about infrastructure and other decisions that are made about their land, and that is a requirement when we're talking both about a fossil fuel extraction as well as mining that might be associated with the energy transition, for example. I think it's also important to talk about people power, which you can think of from both an academic perspective as a researcher, but also as a policy response to the climate crisis, and ensuring that people have access to information, that information is something that they can use, right? Just having information legally available is not the same as the general public knowing what's actually happening and having the capacity to ask questions and make demands based on that information. So this isn't a convening about people power, but it's come up many times. And one of the contexts in which it has come up are conversations about media coverage and about narrative, right? So that we are proposing a narrative for public health and a public health future that we want to see, rather than just reacting to all of the bad things out there and saying we must stop this, but actually saying we want a system that works like this. We want a system where everybody has their place and there's transparency around who's making decisions and on what basis, and where we're trying to minimize one type of actor taking too much power and dominating the agenda setting. And so that means in the whole scheme of things that people need much more power than what they have now. I mean, I could talk about that for an hour, but I think, there are multiple ways, but some of the most important ways are, first of all, that they are greenwashing, right? So they'll talk about how much they're investing in renewable energy, which is actually very little and a decreasing percentage of their portfolio. They might do sort of community level health work, which a lot of the fossil fuel companies, when they consider whether or not they should invest in charitable work at the community level, they do a cost benefit analysis to decide if this is worth their time. So it's not about actually helping people. It's motivated by a vision to maximize their profit, their ability to make profit. They're also talking about individual responsibility, right? Just as we see for other unhealthy commodities like tobacco or big sugar. And so the notion of the carbon footprint, for example, originated with a public relations agency hired by the fossil fuel industry to make us think that it's about our individual choices and not about a structure that requires all of us to be dependent on fossil fuels to go about our daily lives. You can also see in multilateral fora, such as the UN Framework Convention on Climate Change, for example, that there is not only an official role for business, for corporate actors, but also corporate actors who are part of government delegations. If you try to track the number of fossil fuel lobbyists, for example, they outnumber other types of communities at every COP. So for example, at the last one, there were more fossil fuel lobbyists than there were representatives of Indigenous peoples, right? Who are among those most harmed, both by the climate crisis and by the transition to renewable energy. So I think you can see that influence, again, at every level of policymaking, at the level of institutions, but also at the level of narrative and discursive power, and what we believe to be within the realm of our decisions that we as a public health community can make. So the options on the table, all of that is limited by the influence that they've been able to have. And I think especially on the level of public discourse, right? So academics may think that certain options are on the table, but when it comes to what's out there in the news, what everyday people know about, there's often a feeling that we in fact can't do much at all, and that we are relying on fossil fuels, so it's too bad. I think the more that we see unnatural disasters and drought and other extreme events occurring across the world, the more people are aware that climate change is happening. Of course, in many countries, it's becoming an increasingly politically polarized issue, including in my own. But at the same time, public opinion polling done by multiple actors in multiple countries at all levels of income all over the world has shown that majorities of people care about climate change. They're anxious about climate change. They want their governments to do more on climate change, and that they think that their neighbors and fellow community members don't care as much as they do. So this is a really important point, that we need to provide what's called social proof for people to understand that this is an issue that has a wide constituency of concerned folks who want their governments to take more action. So I think that's a sign of hope. We're also having more integrated conversations at the symposium, where some of the public policy levers that are on the table are things that are less typically up for discussion in public health forums. So this includes, for example, not only innovative financing, which has been something we've talked about for a long time in global health, but also tax, right? So we talk about tax in the context of unhealthy commodities to try to discourage use and generate revenue, but here we're talking about it too to try to tax polluters, for example, and provide funding for climate mitigation and adaptation. So I think these conversations, there are always pendulum swings in global health. We talked a lot about debt relief with the One campaign and other efforts many years ago, but these are coming back, and I think given the increasing wealth inequalities, again, in countries at all levels of income, but especially in higher income countries, things are on the table, such as taxation, that haven't been so widely discussed in the past. And so I think that is also a sign of hope.